Good afternoon, everyone. Today we have Emily Strain, and she's going to be speaking to us about physical therapy, how she got into this role, what that entails, any education she's acquired, as well as additional certification. She'll share with us her highs and her lows in her daily routine. Also, how has COVID-19 impacted her daily work style? We ask that you please mute all lines. Any questions you may have, feel free to put them in the chat box and she'll address them at that time. Once again, thank you for joining us, Emily.
Oh, you're very welcome. Okay, so we're going to go ahead and get started. My name is Emily Strain, and I am a physical therapist assistant. And I'm also the Director of Rehabilitation for Twin Pines Nursing and Rehab, which is located here in Victoria, behind the bowling alley. And I actually went to therapy school here in Victoria. I graduated with the first class that went through. So that was in 2012. It was quite the learning experience when we first started because it was new and everybody was trying to get their foot in the door. But I knew early on that I really wanted to do physical therapy. I actually started off as a preschool teacher, believe it or not. So I wanted to really focus on pediatrics. But as I was going through school and kind of going through the program, I was given a lot of rotations that dealt with the elderly population. And by the time I graduated, I thought, you know what, this is where I'm supposed to be. I'm supposed to be working with elderly people, and I never looked back. As far as schooling goes, it is a very competitive market now. When I first started, it was competitive back then as well. But now as Victoria is growing, there's a lot of people that have taken interest in the field. So they do require some basic core classes. It took me about 3 years to finish those. And then the program is about 2 years. If you're looking to go further than the assistant program and actually go and get your physical therapy license, they, within the last few years, actually changed it to a doctorate program. And so those are located at your major universities. They offer one, my mind just went blank, in San Marcos. They have one in Dallas. Where's the other one? My mind went blank. But I also had applied to those. So you do have the option, if you do decide to start an assistant program, once you complete that, to bridge over if you want to pursue your education. If anybody has any questions as far as the schooling goes, just feel free to shoot me a question chat in the box. Right now, things are a little crazy. We went from a very large gym, having patients come in here. We'd see any from 5 to 15 at a time because we have quite a large staff. We have a building that holds about 180 patients. And with COVID-19, unfortunately, we had to go under strict lockdown. So that means that we're not allowing any visitors in and out of the facility. And all of our treatments are done in their rooms. So they're not able to get out. And it's had quite an impact on them. One of the things that we also look at is just their state of mind and how they're handling not being able to see their families and the normal interaction that they have with other residents. Let's see a question. What about additional CEUs? How often do you have to complete those? Okay, so as far as for that question, when you graduate and you take your licensing exam, you pass it, and then every 2 years you are expected to renew your license. And along with that, you are asked to complete 20 additional continuing education hours. And most companies that they have out there that you will be employed with are really great about giving you resources that offer those courses. They offer them online. You can do them in person. You can also have them mailed to you if you're a reader, an avid reader. They send you text, and then you can take the little testing at the end. As far as my day-to-day, I come into work. My day starts about 7:30. I work on scheduling, and I have everybody set up with their designated patients for the day. Pre-COVID, we were coming in and we were bringing them into the gym, and we did a series depending on their plan of care and what their goal was once they left here. And I'll touch base on that in just a second. We focus on anything from strengthening, helping them walk better, working on standing balance. We have different types of equipment. We have standing frames that those that don't have very good balance in standing, we set them up with those. We have stationary bikes that we put them on to kind of help build their endurance as well as work on strength. We have a quite large facility, so most of them do like to do walking if they're able. I know that there's a little bit of a misconception as far as a nursing home goes. When patients come here to get better, not all of them are here long term. We actually, about half of the patients that we have on a monthly basis do end up going home back to their private residence. So it's not always a permanent place. And our goal once they get here is to kind of figure out what they're wanting to accomplish. So if their goal is to go home at the end of their stay here, we want to make sure that they can do it safely. So using the restroom, taking a shower, getting in and out of bed, getting from their couch to the kitchen to make a sandwich. I mean, we have been known to even go to the grocery store and get food to help them meal prep so that they can show us that they can independently do that, so that we can get ready to send them home. As far as what I love about my job, I love coming to work every single day and seeing the smiles on these patients' faces, you know, especially right now since they're not able to see their family like they have been. It's been a few months since we've been on lockdown. They really crave that interaction with us. And so our job is not to just come in and make them exercise, but we're also there on a cognitive level too. We want to make sure that they're doing okay mentally as well as physically. As far as the academic knowledge that you'll need to kind of go into getting your therapy career started, you need to have a good understanding of your anatomy and physiology. We focus a lot on the different parts of the body, nerve endings, kind of what creates pain, and a better understanding of how to heal those parts that are injured. And also we do a lot of documentation. So if you are prepared to write and type, then this is a good job for you, because you do have to document daily on everything that you do with those patients. So a good understanding of your English skills. What soft skills would one need to enter this role? You definitely need a lot of compassion and a lot of empathy, especially with the pediatric population, so your children, and then as well as your geriatric population, which are your elderly. And even though they're on two different ends of the spectrum, I'll take my example since I work with the geriatric population. These people have been independent for the majority of their lives. And then whether they tripped and fell and broke a hip, or they've just been sick, they developed pneumonia, they had a stroke, these are all very new things that they're experiencing. So they're not only having to work through the fact that their body has changed rapidly in a very short period of time, but also that they're not able to do the things that they were prior, and they need help with that. And sometimes that's a hard thing to grasp as an elderly person, because you're used to doing things yourself. And so it's really important to allow them to see that, you know, you're not here to take things over and take away that independence from them, but just to kind of show them that you're here to help them be as independent as possible. So I would definitely say that you definitely need compassion for your patients. You need that empathy, allowing them to see that, you know, you are trying to understand where they're coming from and that you're there to help them. You're not there to hinder any progress. As far as your safety or personal protective equipment right now, it's a little bit crazy. Prior to going into the whole COVID-19 situation, the only reason that you would need to wear PPE is if you had somebody come in from the hospital that had something contagious. So that's your MRSA, C. diff, anything that you could potentially contaminate other patients with or yourself. And as just hospital protocol and even nursing home protocol, when you get a patient that comes in that is recovering from one of these illnesses, you do have the equipment placed outside their room, and then you're aware of these are the things that need to be placed on before entering. Right now, with COVID going on, we're very fortunate that we do not have any cases in our nursing home, and we've worked very, very hard to keep it that way. And I'll show you my lovely little mask. We wear these in order to get into the building every single day. These are just cloth masks. We do have to have these on the entire time that we are in the facility. I'm making the exception now because I've closed myself off in my office, and that way you can hear me a little bit better. But then we also have surgical masks that we have to wear when we are treating patients in their rooms. And they're just your simple little surgical masks. A lot of us will keep one under, so we're double protected. We do right now currently have a COVID wing in preparation if we were to accept a patient from the hospital that was, or we found out at a later date was positive for COVID. So we are prepared for that. And we do, on that particular wing, have N95 masks as well as gowns, gloves, and then your plastic mask, face shields that would go over your regular mask. And those would be worn per each patient. So we would have to go in and out of each patient's room and take on and off that equipment and change it with each patient that we have. Does anybody else have any other particular questions for me? Normally I would give you all a tour of our facility, but because, like I said, we have strict restrictions in place and regulations from the CDC that I can't be going in and out since all of our patients are on lockdown right now. I can't roam the building. What extracurricular activities do you suggest for a student to partake in? As far as your application for PT or PTA school, a lot of colleges now require you to do observation hours prior to applying to the program. And so that's probably one of the biggest ones that you can do. Also, volunteering at the nursing home, volunteering, daycares, any place that will allow you to come in and observe different aspects. Even if you're in high school and you have the opportunity to jump on as a trainer for any of the sports programs, I would suggest doing that, so you kind of get a better idea of what we see every day, depending on what area of study you're wanting to go into in the therapy world, because there are several. Does anybody have any more questions? What advice or encouragement do you have for students? Work very hard, and and apply yourself. This is like I said earlier, it's a very competitive career, especially trying to get into school. There are many students that apply to these programs, but hard work and dedication will always pay off, especially if you're passionate about the therapy world and wanting to help others. This is definitely a great career to have. I've been doing this I started the program in 2010, graduated in 2012. So almost 10 years now. And there's never truly been a day that I've gone to work and then left thinking I need a different job, because I love what I do. I have a very great company that I work for. And it's important to find something that you love and that you really take interest in, because then you don't look at it as a job. Do y'all offer internships, paid or unpaid, for someone interested in the healthcare profession? We don't offer an internship per se. However, we do, pre-COVID, did allow students to come into the facility and do observation hours with us so that they could get a better understanding of what we do and the specific area that we work in, which is the skilled nursing facility. And that way they could not only count those as observation hours, but also make sure that this is a career that they were really interested in pursuing. I don't think that I touched on like salary and base pay, stuff like that. So I'll kind of hit that right quick. Depending on where you work, and then also which field in the therapy world that you go into kind of determines where you're going to fall on the pay spectrum. You can make anywhere from $60 upwards to $80,000 a year just as an assistant, depending on whether you work at a hospital, nursing home, home health, and then you also have sports medicine, which is your outpatient clinics that you see more commonly with younger athletes that come in that with sprains, knee injuries that are needing therapy after surgery. Like I said, work in a skilled nursing facility. They tend to pay a little bit more. Home health tends to pay a little bit more, but generally the price base starting out as a new grad, you're looking somewhere between 60 to 65,000. And then depending on where you go to work at in Texas and even out of the state, you can see upwards into the 80s. So it's definitely a good paying career. Does anybody have any more questions? What is the difference between staff and traveling PT? So a staffed PT would be somebody that's in a building full-time. They come Monday through Friday. A traveling PT is somebody that's hired on contract. Those contracts can range anywhere from 6 weeks to up to 24 weeks. And then once that contract's complete, they either have the option of signing an extended contract to stay at that same building, or they can look for another contract elsewhere. I actually have had quite the experience with several contractors, occupational therapists, as well as physical therapists. And I've been able to meet some very wonderful people from all over the US. We recently had one from Hawaii, and then we had another one from Montana. So they actually both do 13-week contracts, and then they travel to the next state when their contract's complete. But then I also have another therapist that's currently here, that's been here for over a year, that she's a traveling PT, but she's enjoyed our building and we've enjoyed her, so she continues to extend her contract. But would a contracted individual need to have more years of experience, or can a recent graduate do it as well? You actually, either or, it depends on the contract company that's doing the hiring. A lot of them don't require you to have years of experience. It's just one of those things that's preferred. But we have actually had several that had recently graduated from PT school that had come to work for us, and they did just great. Currently, as the question is, are licenses similar from state to state? Right now, as far as Texas goes, the most similar requirements are for the state of Louisiana. Every other state, there does differ. The requirements require you to do extra continuing education courses. Some have specific state testing that's required. We're actually one of them. Once you complete your state board exam, we also have what they call a jurisprudence exam, which is allowing you, once passing your licensing exam, to practice in Texas. And I know that there are several other states, California is one of them, New York is another, that do require a specific state test to be done. Louisiana does not. That's why I said that they don't. Louisiana and Texas don't differ that much, because if you've taken the state exam for Texas, Louisiana will let you carry that over. How tough or difficult are the state exams? What are the costs of those exams, and would an employer assist you in those costs? The state exam is tough. I'm not gonna lie. I was very fortunate that I did pass it the first time, and so I did not have to retake it. Your board exam runs between $400 and $500 with the exam fees and then registration fees. It's not easy, but if you apply yourself during the program and you take what you've learned from the program, you should do just fine. I believe that the Victoria College program has a 95% pass rate on their board exams. So they definitely, if you are planning on trying to get into the program here, they do prepare you very well for that exam. And then as far as an employer assisting you, that would just depend. A lot of them, once you are hired on full time, when it comes to renewing your license, they do assist with the cost of that, but I'm not familiar if they actually provide reimbursement for the initial board exam. Okay, what are some do's and don'ts that would keep students from participating in a field or career such as yours? I would say, well, I can tell you from my experience, I do a lot of the hiring for our company. When we have a new therapist that comes in, that's part of my job, is to interview them and decide whether or not I feel that they're a good candidate for this facility. And one of the first things that I look at is their social media. I want to know if they have a Facebook, if they have an Instagram. Some people laugh and they say, oh, that's kind of creepy, but I want to see what you do outside of work. I want to see how you represent yourself, your family, and are you going to be somebody that can represent our company in a positive way? So that's just one of those things that you always have to remember. Social media is very loud and important, it seems, these days, but you have to remember, you have to be careful what you post sometimes, because there are a lot of people that see that. What are some do's and don'ts? That's the same question. Lots of volunteer work. That's one of the do's. If you have the opportunity to go help out, whether it's Relay for Life. I know here in Victoria, they do a buddy walk, which helps raise money for Down syndrome and children with disabilities. So that's another good one. But just volunteering your time and and getting yourself out in the community to represent in a positive light. I feel like we have a lot of negativity in the world right now. So anything that you can do to bring positivity and awareness to the field is also a plus. Okay, so one of the other things that, we also need to touch base on, and one of the reasons why I don't have the opportunity to give y'all a tour is in the healthcare field, we have privacy laws in place, also known as HIPAA. Some of you may or may not be familiar with those, but that is a law that's in place that protects patients' privacy. And that's, when I brought up the social media don'ts, when I look into hiring somebody, that's very important. I've actually had some therapists in the past that have had bad days, have had situations, and they've taken to social media to kind of vent and let their frustration out, and have actually ended up losing their jobs because of it. So it's very important. I'm not saying don't have a social media page. I personally have one, and that's okay. But just remember that at the end of the day, you have to keep your personal and your professional life separate, because if you allow them to bleed over, sometimes we say things out of frustration or anger that we don't necessarily mean. And once it's out there, you definitely can't take it back. And even though it's a competitive world, the therapy world is very small. And so I get calls very frequently from companies of asking to do references for people I've either gone to school with or have worked with previously in the past. And I have no problem giving wonderful references. But then I've also had a few that, I've had to be honest with the potential employer and let them know of different situations that have arisen. So just be very careful, when you decide to post on social media, that you're trying to stay positive and not bring your bad work day home. Okay, another question was asked, do you have to provide your own uniforms, or does your employer? We at our facility wear black scrubs, depending on which company you work for. Some of them do provide you with uniforms. We are fortunate in the sense of we get to kind of choose which brand that we want. We do pay for them ourselves. However, we do have a reimbursement fund at the end of the year that we can use to put towards reimbursement for those scrubs. So our company does pay us back for them, but we pay for them initially out of pocket. Does anybody have any other questions? Does Twin Pines still offer free CME classes? Yes, they do. We actually just finished one up last week. So, and they do those here. They've started doing those here in the gym, and they run about 6 weeks on a regular basis. But I think now, since we're kind of restricted with the COVID regulations, they're doing a fast track program. So I think it's only 4 weeks right now. Could somebody bridge from CNA to physical therapy? You would have to, as far as taking the CNA certification, it is just a certification. So there's no licensing behind it. You do have to take a test at the end of the 6 weeks, but there's no college credits required. With physical therapy, if you're interested in doing the PTA program or the PT program, you will have to have specific college requirements applied prior to applying to the program. So it's not necessarily considered a bridge program. I would say that you would definitely have a better understanding of what we do if you chose to do the CNA program first. And then, yes, the second follow-up question was, would they be a better candidate when trying to apply to the PTA program? I would say absolutely. number one, you do have a better understanding of the role of what we do just with your hands-on patient interaction, but you're also, observing what we do on a daily basis. You're working with patients on a daily basis, and you're able to use your time spent as a CNA on observation hours that you're going to be required to have applying to the program. Okay, so the next question is, what are some major differences when working at a rehab versus a hospital? So I've actually done both. In your hospital setting, though, you'll see the patients that are fresh out from their injuries. So whether they've had knee surgery, they've had shoulder surgery, they had a fresh stroke, the hospital will usually keep them for up to 30 days, depending on the severity of their issue. And then once they discharge from the hospital, they're usually sent to a skilled nursing facility or rehab facility like the one that I currently work at. And so I kind of consider our company, our rehab facility, the kind of the in-between. So what that means is you're too well to be at the hospital, but you're not well enough to go home. So we kind of bridge that gap and work with these patients until they are ready to go home so that they're safe once they get there.
If no one has any further questions at this time, I want to thank you all for participating in today's session. Also, thank you for providing all this information to us, Emily.
Of course.
Appreciate it. And if we have any students or individuals that want more information, please email me and we can forward those questions along to Emily, and maybe she can address them and talk about the CNA program or even the physical therapy program there.
Absolutely.
Thank you all once again. You all stay safe and stay healthy.
All right. Thank you very much. I appreciate it.